So these are my big issues regarding vaccines, and these are the things that I'd like to highlight. Number one, there is no education in medical schools that I am aware of, and being an educator at the Cleveland Clinic Lerner College of Medicine and Case Western Reserve University, I am not aware of education around vaccines, their contents, safety records, informed consent, or the Vaccine Injury Compensation Program. We do not discuss that in 1986, Congress enacted legislation removing all liability from pharma related to vaccine adverse events. What are we taught about vaccines? We are taught to memorize the vaccine schedule. And actually, I'm going to be sitting for my family medicine boards this year, and I am sure that I will have to memorize that schedule again in order to pass that exam. We don't discuss that almost $4 billion with a B has been paid to vaccine-injured patients since 1992. For medical professionals, we expect fair balance, but vaccines seem to be absolved from that consideration. Number two, there appears to be a conflict of interest regarding payments to providers for completing vaccine schedules. And a corollary to that, which would be number three, patients are being dismissed from practices because of, quote unquote, vaccine safety concerns. If you bring up a question about a vaccine and you decide not to vaccinate your child, you may be at risk of being terminated from that practice. Absolutely deplorable and disgusting. Number four, and again to the Bailey family, I'm really sorry, but employers are forcing employees to receive the flu vaccine or face corrective action or job loss. And the fact that your dad was 6 months from retiring is... Number five, there's a lack of informed consent, and I was one of those providers who didn't provide safety sheets before vaccinating. I would tell the parents, these are the vaccines today. We're going to give you 3 vaccines in one leg and 2 in the other. And then after vaccinating either the child or the adult patient, here's your information sheet. And again, to be completely transparent with you, I had no idea that there was even a mention of the compensation program or a telephone number to call. Absolutely deplorable on my part, and I apologize to my patients. Number 6, there's a lack of transparency regarding vaccine complications. And worse, you're being shamed as patients for suggesting that you were harmed by a vaccine. If I see a patient in the office and diagnose strep throat and give them penicillin, and either the mom or the patient themselves calls and tells me that they developed a rash, there is zero question. The chart now states they have an allergy to penicillin and will never be given it again. Why don't we believe parents and patients when they tell us they have had an adverse event regarding a vaccine? It doesn't make sense to me as a medical professional. I apologize for being emotional.